Hello, my name is Ronan Banim and I am an orthopaedic surgeon working out of Chester. My interest in orthopaedics started, well, probably even before I went to medical school, but certainly in medical school. At the time, we tried out different specialities, and fairly early on, I found orthopaedics. It was something that immediately made sense to me. I enjoyed my time in theatre, and from there on, I sort of planned my career around becoming an orthopaedic surgeon, experiencing things like rheumatology and other surgical specialities to allow me to develop my career in orthopaedics. So it started at quite a young age, shall we say. The most rewarding thing about being an orthopaedic surgeon is seeing how you make people better. It's one of the very few specialities in medicine where you can truly make a difference to people's lives. So particularly when, for instance, you replace somebody's hip and they come back a few weeks later out of pain and able to do their normal, simple activities of life again, that feels amazing. Of course, it's fantastic to work in theatres, it's fantastic to work in many of the hospital environments, but overall, the most important thing is how we do make a difference to people's lives. If you come and see me, what you will get is an honest assessment and answers to your questions. When I see you, we'll take a history, we'll go through some simple details, age, occupation, things like that, and then some specifics about your actual problem, things like where the pain is, what it stops you doing, and how it affects your life. We'll also look into other medical problems that you might have that will influence what sort of treatments we can give you. We'll then examine you and do some tests. Not always do we need to do fancy tests, it's often just an x-ray. From that, we can build up a picture as to what's wrong and then start to go through the options of treatment with you and the patients. It may be that we can't do anything, and if that's the case, I'll certainly try to explain what the other alternatives are and how you can carry on. But when there are operations that we can do, we'll go through them in detail with yourselves and make sure that you understand the risks and complications and give you the option to choose to have an operation or not if that is your wish. So generally we'll try and give a full explanation and full and honest explanation as to what's going on.